In this presentation, I'll be demonstrating how to give an IV PiggyBack medication. We're again taking care of our patient, Tom Silver, and this morning at 8 o'clock he has a dose of Zosyn due, which is an IV PiggyBack medicine. And so I'll enter the med room in order to get the medication. In terms of what I need to know, I'm going to be hanging this through his primary line, so I have to make sure that the Zosyn is compatible with the primary fluid and any additives that may be in the fluid. In addition to that, I need to know the safe infusion time. The safe infusion time is typically right in the order. But however, if it's not there, then we would have to look it up in a drug book. In terms of compatibility, remember there's a compatibility chart at the back of the drug book, and there's also compatibility charts in the med room, or you may find one in an online source. So just make sure that in this case, the Zosyn is compatible with the D5 half normal saline, which it is. So I'm going to go ahead and get his medication from his drawer. Oftentimes, IV PiggyBacks are in the med room refrigerator. Many of them need to be refrigerated. I'm going to go ahead and pull up his chart, and then I will do check 1. I'm going to consider the supplies that I need to hang the medication, and I will need an IV PiggyBack tubing, and this is called a secondary medication set. It's a short tubing with a blue hook in the bag. So we're going to need that, and then I'm going to need to label the tubing because the tubing has typically a 24-hour expiration. So with these items, and I have alcohol in my pocket, with these items, I am now ready to transition into the patient's room. And now in the patient's room, I'm going to wash my hands, greet the patient, let him know that I have his morning antibiotic. I'm going to pull up his chart, and then I'm going to ask him to confirm name and date of birth. He tells me name and date of birth, and I ask him also to confirm allergies. With that, I'm going to do my second check of my medication. And so I'm checking Tom Silver, and he is getting his Zosyn due this morning. It's by IV PiggyBack, over 30 minutes, due this morning at 0800. And this makes sense for Tom Silver because of his infection. So I do check number 2, and after check number 2, I am going to go ahead and prepare the medication. So I'm going to put it on some PiggyBack tubing. Gloves at this point are optional. So if you care to wear gloves, you can, and if not, you can just have freshly washed hands with the preparation. I open up my tubing. You'll see it's a very short tubing. We'll use the hook in a minute. And then I want to make sure that I have hold of both ends. I have just a roller clamp in the middle, and it's very important that I clamp it. If I forget to clamp it, I will lose the medication. It'll start rushing out as soon as I spike the bag. And so I'll lose the medication, which will compromise the dose. So I would have to call the pharmacy and get another dose. So just make sure you check and double check your roller clamp. All right, so I'm going to go ahead and put the spike in the bag now, being very careful to use a no-touch technique. And then I am not going to prime just yet because I'm going to use a technique called back priming. Once the bag is spiked, you can lay it on the table momentarily because everything is covered. And then we're going to go ahead and we're going to label the tubing because this tubing will expire in 24 hours. Now that it's labeled, I'm going to go ahead and do my third and final check, and I'm going to scan everything in. So I do check 3. I hit administer. I scan the patient's wristband. And I scan the medication itself. So all of my checks and balances have been satisfied. So now I'm going to go ahead and get ready to hang the medication. So I begin by pressing stop. So I'm putting the pump on hold. Again, because I'm working up here, gloves continue to be optional. If you want to put gloves on, you certainly can. And for the sake of this presentation, I'll go ahead and put some gloves on. All right, so now I'm ready to attach the infusion to the secondary infusion to the primary. I'm attaching at the Y site closest to the pump. Remember, I have yet to prime, so pump is stopped. I'm scrubbing the hub. I'm attaching the secondary tubing at the uppermost Y site. And now I'm going to go ahead and I'm going to prime my tubing, but I'm going to use a technique called back priming. And back priming, just as the name implies, is kind of, if you will, backwards priming. It primes from the bottom up as opposed from the top down. So it's a gravity process, so I have to hold my PiggyBack below my primary, and I'm going to very slowly open up the roller clamp. So I open up my roller clamp, and you could see that the fluid is traveling down the length of the tubing up towards the drip chamber. And I will back prime until my drip chamber is 1/3 to half full, and then I'm going to clamp. The advantage to back priming is that in this way, we do not lose a drop of medicine. It is perfectly acceptable to forward prime, and if you prefer, you can forward prime, but you must be very careful not to lose fluid, because that will then alter the medication dose. Okay, so now my tubing is filled, and I can go ahead and hang it on my pole. And remember that I have to drop my primary bag, and I always wait till I'm done back priming to drop the bag, because it's by gravity, it will back prime more easily if my bag is higher, but then I do have to drop it. So this is in position, and then now I'm going to program it on the pump. So I'm going to hit review program, program secondary. It's asking me for the medication name. It will always want it in its generic. So this is Zosyn, which is piperacillin tazobactam. So as if I am texting on a flip phone, I'm going to go ahead and put in PI. It brings up piperacillin tazobactam. I highlight it. I press OK. Now it's asking me for my dose. I have 4.5 grams and 50. I will highlight that dose and press OK. It asks me to confirm once again, and I do. Yes, that's correct. Secondary bag. This is in fact how I'm hanging it, as a secondary infusion. I press OK. And now this pump should actually calculate the rate for me. So the smart pump will typically then bring up the rate. In this case, this particular pump did not, but I know that I have 50 milliliters over 30 minutes, in which case it will run at 100 milliliters per hour. So I'll place that into the pump. And then volume to be infused is the volume in the bag, 50 milliliters. I never want to set that short, because I want the full amount to go in. So I confirm the volume. And then at this point, I'm going to open up the roller clamp wide on my PiggyBack tubing. All other clamps are open, and then I can press run. Now the pump is reminding me to be sure that drops are dripping in the secondary infusion and not in the primary, so I will make sure that I stay here for a minute or two and confirm that I have drops dripping from my Zosyn infusion and my primary infusion has stopped dripping, okay? So just to make sure that everything is running appropriately, I'll confirm, and then I'll press yes on my pump, and then it will tell me that my piperacillin tazobactam is infusing at 100 milliliters per hour, which will take 30 minutes to deliver that dose.